Okay, welcome everybody to the Lunch and Learn on Low Back Health. My name is Amy and Sam is with me as well. We'll do a little bit deeper intros in a minute. But so we're going to be doing a quick webinar for the next 30 minutes on low back health. And I don't want to get too hyper focused on low back. We're just going to kind of cover in general core and back and maybe a little bit of hip as well. Because it's all kind of connected. There's muscles that cross all of those joints and things. So it all kind of works as a system. So I didn't want to get super focused on low back too much, but so that's good. What's going to happen today on the webinar. So welcome. All right, quick poll. We're trying to make this interactive, so feel free to throw emojis at us, reactions while we're doing this discussion. And we're going to do a couple polls here. So first one here is, what do you feel contributes to your specific low back health or lack thereof? So if you're experiencing discomfort or things going on with your back, not necessarily your low back, it could be just back in general, what do you feel like is kind of the main culprit? Whether you're in a really great state in your back or if you're not in such a great state, what do you think you could do better or keep working on?
All right. Now let the results compile here, which is immensely satisfying watching the numbers come in. All right, got most of the people here, so I'm going to go ahead and end that and share results here.
Interesting. All right.
Posture takes the cake.
Takes the cake for most of us. All right. So there was no like wrong or right answer. Obviously, it's just how you feel, what contributes to what's going on with your body. And so it's just enlightening to kind of see what people think. So the main thing or the things that we're going to cover today in the presentation is kind of basic spine and back / core anatomy. We're not going to dive too deep. We're not going to get too specific, but just kind of visualize what the muscles look like, and then talk about what the back does and what contributes to those movements of the back. So the movements rather. What can we do to optimize back health? And then if you are experiencing back pain or discomfort or anything going on, what like troubleshooting what that might be in terms of biomechanics and kinesiology point of view. So we're not here to diagnose any chronic conditions, of course, we're not doctors, but keep in mind that we're trainers with an exercise science background, and that's kind of the perspective we're taking today. And with that, we'll do a little bit of a deeper dive into our background. So my name is Amy. I'm the Target Fitness Program Manager. And my background, I have a bachelor's degree in exercise science and a master's degree in exercise physiology and nutrition. And then my focus in the past, 6 to 7 years has been prenatal and postpartum specific fitness. And so with that, you can probably imagine there's a lot of musculoskeletal things with the back and pelvis and things like that I do have a little bit of perspective on.
Yeah, and I'm Sam. I'm a health fitness specialist with Target, and my background education-wise is also kinesiology, so exercise science, and then psychology. So perhaps you've seen me in the meditation programs that we've done in the past. And then more recently, my current obsession is really about implementing kind of this daily movement idea, which will be a talking point later on when we talk about the kind of services that we provide. So I'll leave it at that for now.
All right. Really quick overview of spine and anatomy and the muscles that kind of go with that. And so you can see there's a lot going on around that low back and just back in general. And on the right side, you can see there's some muscles even deeper to those surface muscles. And on the front side of the spine that affect how you move. And you can see that there's muscles that cross the hip, there's muscles that go diagonally, there's muscles that go horizontally. So there's all sorts of different planes of motion, direction of muscle fibers and all of that. There's lots of connective tissue in there, tendons, ligaments, fascia that play a role in mobility, how those muscles contract and relax and all of that. So the main point of this slide is just to kind of give you a perspective of how much is actually going on with back health. And so, which is why we can't go too far down the rabbit hole with different things with the back, but we can have a place to start with like what our back does. Okay, so I'm gonna kind of get up and demonstrate a few of these. I didn't want to like put too many photos and get confusing. So abilities of the back or motions of the back, and this involves core as well and hip. So I don't want to get too specific here, but so flexion with the back is literally kind of just rounding forward, and extension is coming back up to neutral. Lateral flexion is, if you can imagine like a side crunch. So going out like this and coming back like so, that's lateral flexion. And then rotation, I'll kind of go down to one knee here, is rotating like so, and it can be straight left to right rotation, or it can be kind of like a diagonal rotate, lots of different things that involve rotation. And then I included some pelvis movements as well. Pelvic tilt is kind of like tucking the tailbone. So this is posterior tilt, tucking the tailbone, kind of squeezing the butt. And then anterior tilt is kind of arching the spine and rotating forward. If you imagine your pelvis as like a bucket of water, pouring water forward is anterior and pouring water out the back is posterior. And then you can do pelvic tilts left and right as well, kind of lifting the hips either direction, or you can kind of do like a combination lateral flexion with pelvic tilt to kind of get a side crunch as well. So none of those movements like work in isolation usually as far as like daily movement. But those are kind of what those look like. And then stabilization, if you think more like planks or things like that, where you want to prevent movement of the spine, that's when the muscles of the core stabilize instead of creating movement like I showed you with those other movements. Anything to add there, Sam?
Yeah, I was just gonna say for example, with the express core class that we teach, I mean, we try to be strategic with adding in all of these elements to the movements that we're doing in the class. So part of it is getting stronger core and maybe more aesthetic reasons too, but we're also trying to very strategically add in all of these elements from more of a functional standpoint, so that we can rotate, so that we can stabilize, flex, etc. So it really it's very much applied to what we're doing with classes and with our training too.
Yeah, and just activities of daily life, like you're not just going to be just holding your core stable the whole time, all day, every day. You need to be able to add movement and do things, in all sorts of different positions, in lots of different scenarios, especially if you're a parent, which I know a lot of folks are probably on the call. All right, some players in low back health, this is definitely not a comprehensive list, but we feel from an exercise or a kinesiology point of view, these are kind of the focus that we like to talk about: strength, mobility, movement, and rest. So this is going to be a really quick slide because we're going to come back to this, the players of low back health, in a little bit. All right, another quick poll here. How often during your work day do you take breaks to move? If this might not be intentional, so include things like going to the bathroom, going to take your lunch, things like that. You can also include your intentional breaks if you specifically schedule breaks in your day to add movement. So give us your answer of how many breaks you take to move.
Very nice. Right.
Nice.
Very nice, everybody.
Yes. So I was just talking with Sam before we hopped on this call. Some is better than nothing. So, and we didn't even give an option for nothing. So hopefully somebody, no, there wasn't anybody that needed the 0. But so that's great. Movement is definitely a positive thing when it comes to back health. So we're going to be talking about optimizing back health, and keep in mind that back health, and on the other side of that coin, pain or discomfort, it's very multifaceted and complex. There's a lot of things going on, and think back to that anatomy slide. There's lots of things that can go right, and there's a lot of things that can go wrong. So just keep that in mind. And we're just going to touch on a couple of the things that you can do to kind of hopefully move the needle into more optimal back health. Okay, so the players that we like to talk about from an exercise standpoint, or from a kinesiology standpoint, biomechanics, whatever you want to say, is first we like to talk about strength. You hear a lot about core strength and stabilization and things like that, including strengthening exercises in your program that include what your spine does, right? What it's capable of doing. So those movements that I led the presentation off, we want to make sure that we're doing movements like that in our workouts. It might not necessarily need to be like heavily loaded, so you don't have to like do these movements with a huge barbell or anything, but doing things like rotation and stabilization and flexion extension is important to be able to move efficiently, right? And then mobility, to be able to move through a good range of motion that's required for activities of daily living. And one thing I wanted to touch on with mobility is that flexibility is a component of being mobile, but it's not just about being able to move into your end range of motion or those really extreme ranges of motion. We want to be able to like move through your joints and be able to like functionally use the joints, right? So it's not just about like being able to like do the splits or whatever. Like you also need to be able to be functional and be able to move and be strong in those positions.
Amy,
Go
question
ahead.
for you. So, for example, with strength training, we often have goals that we're shooting for. So maybe it's a certain amount of weight on the bar, a certain amount of reps that you're doing, or lowering body fat. There's lots of goals that we have with strength training. With mobility, what is from a more practical standpoint, like what are we shooting for exactly, would you say? Like, is there an end goal that we should be doing? Is it function? And like, what is function exactly? What's your thought? Not that there's a right answer to that.
Yeah, that's a lot to take on in a one question. I think mobility, I think for most people, is to be able to move without restriction to things that you want to be able to do. So a good example of this is like as a parent of young kids, you're on the floor a lot. And so being able to sit and not be uncomfortable because it's really stiff, or it's a really like uncomfortable position for you because you can't move your limbs in a way that gets you on the floor comfortably, or being able to move to get up off the floor in a nice way. And so the end goal for people can be very individual, especially in their season of life. So that's a loaded question, and
Sure.
the classic answer of it depends.
Yes. Depends on the person. Yep.
Depends on the person, but generally you want to be able to move through joints without discomfort or pain, or your muscles being too stiff or too short, or to make it uncomfortable. So depending on what you do in your life would definitely dictate what kind of mobility you need. Yeah, great question, great call out. Moving on to movement. And so this doesn't necessarily mean like workouts, although we love to, promote working out, but recently, or like the more recent research indicates that posture is not as big of a player in low back pain as standing still. So a lot of physical therapists and people in that field really like to promote movement through your day, whether that's stretching or just walking, things like that. It's more about standing still for extended periods of time And with respect to low back health, movement is really the key, right? So, but there's a lot of different things that movement is good for, not just low back health. So like double dipping, if you will, and Sam can touch on this a little bit too, but double dipping movement throughout your day is beneficial for so many other reasons too.
And for going back to the poll question, it's good for your posture too, which is what kind of more culturally we always hear posture, posture, posture. And more recently, based on what you just said, the daily movement might be even more important than holding a correct posture.
Yeah, and not to say that posture, you shouldn't ignore posture by any means, but it shouldn't be super hyper focused in, when you're speaking to back pain or back discomfort. A lot of the treatment or like the suggestions, the recommendations for back pain, if it's, from an exercise kinesiology perspective, is more about movement and not standing still. And so I also want to touch on like posture. There really isn't a perfect posture either. So I wouldn't really like get down on yourself if you feel like you don't have quote unquote good posture. So just a little side note there. And then just a quick note on rest. 2 points here on rest days and sleep are 2 different points when it comes to rest. So obviously we did a webinar on sleep last week and you can go back and watch that if you haven't yet, but sleep itself, obviously you're in a horizontal position. You're not putting stress on the, muscles that stabilize and, do works to keep you upright. And so that allows those muscles to rest, recover, rebuild, get stronger. And then rest days, if you are a person who works out pretty regularly, more than, multiple times a week, that kind of thing, doing lots of strength workouts, it's important to definitely include rest days weekly in your regular routine for that same reason. You can't recover, build, stronger, progress, all that thing. You can't gain momentum or progress without actual rest days.
Yep. And rest days could be this kind of active recovery idea. A rest day could still include mobility and movement, right? It's just you kind of, like we were saying before, it kind of depends on the person knowing yourself, your limits, how you're actually feeling more subjectively. If you should really take it easy, or if maybe you can still do a walk, or you can still do some mobilizing exercises and movements. So rest doesn't have to be just actually doing nothing during the day too. So it depends. Again, the classic trainer response.
Oh, I skipped ahead. There we go. I didn't mean to go that far. All right. So part of those components are movement, right, and mobility. So playing on those 2 specific things here is I like to increase awareness of like those smaller movements that happen in the joints of the low back and pelvis and hip area. So I'm just going to do a quick little like interactive exercise here. We're going to be doing pelvic tilts, which is one of the harder things to do if you're not like a little bit more aware of your pelvis. And so in your chair, we're going to do a pelvic tilt. So you're going to sit up like tall, and we're going to do an anterior pelvic tilt like I showed you. So you're just going to kind of arch your spine and pull your pelvis forward like you're dumping water out of the front of your bucket, and then do a posterior pelvic tilt. And this is kind of like the more like slouchy position. And you're going to get some movement in that low back as well. You'll get compression and extension, or flexion and extension in that spine as well. So go really slow at first, just trying to move just the pelvis as much as you can. And then we're going to do the lateral flexion. So you're just going to lift one up, squeeze it, get a little bit of a side crunch, and then the other side. Again, trying to just move the pelvis. And if it's okay if it's just a small movement, especially if you're new to these movements. And one thing that can help, and you can take a little break here, one thing that can help with those movements, getting more mobility and awareness through those joints, is maybe doing it on a stability ball or a Swiss ball. So you can kind of like get a little bit more range of motion than just a flat chair. And so the ball will move with you, and you have to do a little bit more core control there too. So a ball can help. And then I like to do these with or in a tabletop position, so on your hands and knees, and just kind of do the, almost like a cat-cow, but just in your pelvis. And then you can also do kind of full circles as well, do that, do like a pelvic circle or a pelvic clock, I've heard it called as well by pelvic floor physical therapists. And so, yeah, getting mobile through your pelvis or being able to move, not necessarily like for free movement all the time, but like being able to move through those joints can be good awareness.
And I would add these more subtle kind of nuanced movements. If we don't do them all the time, they feel almost like awkward and confusing to do. But that's just because we're not used to those like motor patterns in our brain. They're just not active yet. So it's going to, just like anything, right? It's going to take some practice for your body to feel comfortable, and maybe a better way of putting it is knowledgeable of like how to actually move in these positions. And then over time, it becomes the default. So,
And you'll be able to recognize when there's movement, when there shouldn't be movement. So like those core movements that stabilize, for example, like if you're in a plank or like a V-sit or something like that, and you can feel your pelvis moving a little bit better if you're more aware of what it actually feels like. If you have no idea what it feels like, maybe you don't know it's actually moving when you're supposed to be stabilizing in a movement like that. Okay, one more interactive. So this one is going to be hip movement. So I included hip because as you saw on the anatomy, is that there's a lot of muscles that cross the hip, that go in front of the hip, that go to the back of the hip, that connect to the low back, the vertebrae in the low back that like are internal almost. And so that are responsible for a lot of these movements and can absolutely affect what the spine feels like. And so flexion extension, you don't have to get up to do this one. You can just lift the knee up and down like this. We're in a flexed position, just seated. So extension would be more like that. And then internal, external rotation is going to be like lifting your heel up that way or that way. And then abduction and adduction is just taking the hip or the leg away or adding it back in. So, and then the one that's not on here, I couldn't find a good picture for, is circumduction. So that's rotating the leg in the hip joint like this, kind of making a circle. And so that's where a lot of the mobility movements that we do in recharge race and things like that come from, is kind of these hip movements. And important to, the hip is a really versatile joint, and we need to be able to move through that joint comfortably. And so this can also play a role in what happens in that low back area as well. All right, really quickly on this one. Again, we're trainers, we have degrees in exercise science, we're not medical doctors, but troubleshooting back pain from a like musculoskeletal or kinesiology type of perspective. So musculoskeletal discomfort or pain that's not associated with chronic conditions like arthritis or like things like that. Rest and movement balance is going to be important. So a lot of times movement is one of the things that can help kind of do the recovery process, and then resting, obviously, if you feel like that's going to be, if movement doesn't feel good or if it's a little bit too painful, you got to kind of balance those two. But you don't want to rest or stay still too much, kind of like we were talking about during the workday. Also, if you have any sort of discomfort or pain, you don't want those muscles to get too stiff. You need to be able to move through your back. And so balancing those two things is something to do if you are experiencing back pain. Obviously, a primary care physician, orthopedic specialist, and physical therapy are kind of the go-tos if the injury or the pain is kind of past the point of like treating at home. And so physical therapy is going to be great if for finding out and assessing what specific things are contributing to it from a muscular standpoint. So there might be muscles that are weak or too strong or not coordinating well together, or If there's connective tissue issues, ligaments, tendons, if there's tendonitis going on, or fascial connective tissue issues, physical therapy is really great for that. And then had to put a disclaimer in here, obviously back pain can be a lot of different things and might not be musculoskeletal. And so those are some pointers and red flags to go to get care and treatment from a medical professional for. So back pain is definitely can be a sticky thing. A lot of it times it just needs rest and movement, but definitely get treatment if you are having any of those things going on. All right, we got a couple minutes here, but we want to help you with anything that we are able to that's within our scope of practice. So that's going to be, how can you integrate breaks and movement and mobility and things like that through your everyday life. And so we're working on a little bit bigger project called Wellbeing Snacks. So that's coming soon. So just keep an eye out on it for on Slack. This is going to involve like daily movements that you can integrate and move around in your day that works best for you. And they're less than 5 minutes each. And so it's a really quick like movement session aimed at integrating seamlessly into your workday and preventing burnout and increasing productivity, helping low back health, all of those things kind of all in one really small, like doable thing. Any other points on that, Sam?
Bite-sized.
Bite-sized.
Yeah. Yeah, I mean, it's going back to what Amy was just demonstrating earlier. Notice when she was doing those certain, let's call them desker sizes, right? So you're at your desk and it doesn't have to be sweaty. It doesn't have to be intense. It's just preventative care really for your low back and just your health in general from a more emotional, cognitive standpoint, like she was saying, with energy, productivity. And it's just about having the intention to do it. It's not that hard. And we all, for the most part, know that when we're doing these kind of things, we feel better in so many areas of our life, but it's having the accountability and having the intention. So that's what we're hoping to provide with the Wellbeing Snacks. And then similarly with the recharge breaks, that's where we come into either a virtual meeting or an on-site meeting and do a more follow along sort of movement session. But it also could be more of an educational session too. So if you enjoyed this and have more questions of what exactly you could be doing for your needs or something that your team is all interested in, it could be more of that kind of teaching role too that we could provide.
Yeah, and then last but not least, consult and or program design, which is all of this is free and complimentary, just something that we do as a fitness staff. Consult, we meet with you for 30 minutes or so and find out a little bit more about your background and your goals as fitness wise. And then if it's specific to low back health or mobility or strength, we can design something specifically to do more of a like program. And we can design specific movements, specific mobility things that we feel is going to best accomplish those goals. So I know we're at the very end of our time here. So if there's any like really quick questions that we can address, we can do that. Otherwise, you can always follow up with us on Slack or email. And we'll also do a follow-up post on the Bingo channel as well with some takeaways from this webinar.
I'll do a quick question that came in earlier, Amy. So the question is using stretching devices, such as one that where you, I believe it's where you lay over the top and you're in that flex position with your back. What do you think about those in general? Recommendations, warnings, advice, or just device like stretching modalities in general? Thoughts?
Yeah, I mean, I think they can be great, especially at the beginning of your quote unquote mobility journey. If you don't have quite as much mobility when you start out, things like what am I thinking of? Like a yoga strap? Is that the question? I think like things that'll help you get into like bigger ranges of motion, I think is the question. So that can be great in the early stages of mobility if you don't have quite as big of range of motion, but yeah, I don't see anything wrong with them. What are your
Yeah,
thoughts?
I agree. I mean, it depends how it works for you. If you're going into ranges of motion that become painful or uncomfortable. I mean, mobility is one of those things where you're trying to find that threshold of, you don't want it to be painful, but you want to test your limits a bit, and that's how you extend your range of motion. So you kind of have to just experiment a little bit safely and starting small, but testing it out and see how your body does to it. But then just with devices and like foam rollers, etc., having like an object that this is my mobility device, quote unquote, I think it's a good psychological cue of just like, I have this and I want to use it because I spent a little bit of money on it, or I see it in my home environment. So that can be a good way to get started on the mobility journey.
Yeah, none of them are like magical.
Right.
Um,
Yeah.
but if it makes you feel good, if it like feels good on your body and helps you do the activity, the mobility activity in question, like absolutely, if it's gonna
Yeah.
increase your adherence to said thing, for sure.
Yeah. Right. Got it. Any last questions, concerns, witty comments? Go ahead and